Assalamualaikum dan salam sejahtera. Anda sedang menonton agenda Awani secara langsung dari studio Awani di Bukit Kewangan, Kuala Lumpur. Saya sendiri pernah mengalaminya, ribuan rakyat Malaysia mengalaminya. Kalau kita pergi ke hospital-hospital sekarang pun sukar untuk mendapatkan katil-katil yang kosong kerana ramai yang mengidapinya, dan itu adalah musuh utama negara sekarang ini dalam aspek kesihatan, iaitu virus denggi. Dan virus denggi ini kita bangga mendengar baru-baru ini usaha pihak Kementerian Kesihatan berjaya menunjukkan penurunan dalam jangkitan penyakit denggi. Tapi ini masalah di seluruh dunia. Di negara lain misalnya buat pertama kali sampai 21,000 orang dan mereka terkejut dengan jumlah ini. Tetapi malam ini yang saya nak bincangkan, dan ini juga kenangan cukup setakat Samson, tidak pernah kita lupakan warga kerja Astro Awani yang tewas pada virus denggi dan meninggalkan kami di Astro Awani ini. Dan sebenarnya dengan itu juga malam ini saya ingin bercakap tentang kesedaran. Kerana sebagai bekas pesakit denggi sendiri, saya pun tertakluk juga dengan persepsi ramai. Maka apabila kita mengalami denggi itu, fokus paling utama ialah pada berapa ya jumlah plateletnya. Hari ini berapa, semakin turun, kalau turun lagi bagaimana. Dan mereka yang datang mengunjungi itu akan mengatakan, cubalah ni, makan ini, minum itu dan sebagainya. Malam ini hasil daripada tulisan kepada akhbar oleh Profesor Adiba, saya mendapat tamu saya yang cukup istimewa, Profesor Dr. Lucy Lam Chaisi, Profesor di Jabatan Pediatrik Fakulti Perubatan Universiti Melaya, untuk saya bercakap di antara persepsi, realiti dan apa sebenarnya yang harus kita fokuskan dalam menangani virus denggi yang sudah pun menjangkiti seseorang pesakit. Mungkin saya bermula tadi Prof dengan persepsi bahawa fokusnya platelet. Tapi kalau saya Google dan baca, ini untuk orang biasa seperti saya, tak masuk pun kursus perubatan, dia ada leakage plasma misalnya, ataupun kebocoran plasma dalam konteks itu. Dan dia juga ada denggi berdarah dalam konteks yang boleh mengakibatkan juga fokus bukan saja pada platelet, tapi juga pada kegagalan organ untuk berfungsi dan sebagainya. Jadi mungkin kalau Prof boleh bermula dengan jus papaya misalnya, yang sekarang ini diberikan juga tumpuan oleh media-media utama Malaysia. Malah kita ada pegawai kesihatan yang telah pun tampil mengatakan kajian menunjukkan bahawa ada peningkatan platelet pada mereka yang mengambil jus temikai di hospital berbanding dengan mereka yang tidak misalnya. Tetapi mungkin sakit denggi ini dan bahayanya virus denggi di dalam tubuh manusia itu bukan sahaja pada jumlah platelet, tetapi juga pada perkara lain yang mungkin tidak dapat ditangani oleh jus temikai, sup ketam dan sebagainya.
Thank you very much. Could I speak in English?
Sure, go ahead.
Yeah. So I think the first thing that people should be aware of is that there's a spectrum. Like you said, you have had it 3 times, and not all the 3 times are similar.
Yeah.
So that is the reality, because there are 4 viruses. You can get 4 different times. And depending on the way our body reacts, you can have a very mild disease or even no disease, or a very severe disease. So I think that that's the most important thing that we have to bear in mind, that the range of the spectrum is broad. Now when we say severity, for the doctors who are experienced in managing dengue, it is not about the platelet count.
Okay.
Because I've been managing dengue for 24 years.
Okay.
And initially we were like that as well. We were looking at the platelets, and then we found that actually we're looking at the wrong thing.
Okay.
We should be looking at the, like you said, kebocoran, capillary plasma. So then when we started looking at that, and then we treated that, then we found that actually the patients get better, faster. And the platelet count will recover on its own. All right, whether you give papaya juice or even if you give the platelets to the patients, it will not get it up.
Because,
all right, because at the level of the blood vessel, it is eating up all the platelets.
Okay.
So it's not going to make a difference. Even in the old days, we used to give platelets, and then we found that why doesn't it come up? And that is the reality. At that point, everything is so raw at the endothelial, we call it the endothelial level, that the platelets will get used up. So, but again, we said that in the end, we realized that the platelets were not the problem. The culprit is the kebocoran. So what happens when there is a kebocoran is that there is shock. So macam kekurangan air dalam saluran darah. So that is the danger one. So when we refocus on those things, then we found that actually it's very easy to manage dengue. So now those people who have been trained to look at it like this, then they all realize and agree that the platelet count is not important. What is important is that plasma leakage. So how do we look for plasma leakage? Then but the thing is, the two happens together. That drop in the platelet count and that plasma leak happens together. But in a lot of patients as well, they have the drop in platelet count, but they don't have the dangerous one. The dangerous one is the kebocoran plasma. So the kebocoran plasma is the dangerous one. And usually the kebocoran plasma, if there is, their platelets count will also be low. But if the platelet count is low, it doesn't mean that there is kebocoran plasma. So we have to really focus on kebocoran plasma and not the platelet count.
Saya nak cakap pasal kesedaran. I would like to focus on that about awareness because time matters for viral infection. Jadi mungkin dalam aspek itu kalau Prof boleh berikan, Prof ada 20 tahun lebih pengalaman melihat bukan saja orang dewasa, kanak-kanak pun juga boleh dijangkiti. Jadi what do you wish as a doctor that sometimes you get the patient is already well progressed already, but if it only that come to you earlier, so this involve awareness, kesedaran pada peringkat masyarakat, keluarga, ibu bapa, penjaga, supaya bila nampak perkara-perkara macam ni, biarpun tak betul terus pergi ke hospital, supaya kalau betul itu jangkitan denggi, maka boleh dibantu pada tahap awal, maka boleh disekat risiko tinggi untuk kehilangan nyawa dan sebagainya. Your views on that?
Yeah, I think we have to understand that the severity of dengue does not come on the first day or the second day or the third day. When the fever is very high, there is no problem. The kebocoran plasma belum berlaku yet. Now, when will it berlaku is when the fever is coming down. So there is the paradox. When the fever is coming down, why? Because the kebocoran is not caused by the virus. It is caused by our antibody. Producing our body will fight back against the virus, and then the virus and our antibody will form a complex, and depending on the sort of complex, it will cause the kebocoran. So the kebocoran, usually we say that is after 72 hours of fever. Biasanya is on the hari yang ke-4, ke-5, or ke-6. These are the three, the first, the time when we call the critical period. All right, so it is when the fever is coming down, not when the fever is very high. So the first 3 days, the fever is very high, a lot of pain, headache, but actually that time, you check the blood, the platelets are not so low, the kebocoran belum berlaku yet, but a lot of symptoms because there's a lot of virus in the body. But the virus by itself does not cause the kebocoran. It's our antibody that fight back. Fight back this. So that is when the kebocoran. So from 4th day onwards, we start to look for it when the fever is coming down. So now not everybody will get a kebocoran. Like you said, that the first time it was quite mild. So maybe only 5-10% of people will get the kebocoran, and maybe 30% will have the low platelets. So the rest of them are going to be okay, and 70% of the people who actually get a virus will not even have the fever. So actually what we are seeing is the 30%. So out of the 30%, now we concentrate on the 30%. So out of the 30%, 10% of the 30%, that means maybe 3%, will have the kebocoran. And maybe half of the 30%, that means 15% of the total people who get an infection, will have the low platelets. But not all low platelets are related to kebocoran.
Okay, Prof, kita pergi rehat yang pertama. We go to the first break, but once we are back, sometimes the speed shock the family members and friends. Because the guilt will reside, because if only we had brought him or her earlier, how could we not have seen it? Jadi pengalaman Universiti Melaya dalam konteks ini, kerana ia juga universiti yang melakukan penyelidikan in this research too, and I'm sure you also share your expertise among the group. So what have we learned all these years, and what are we studying right now? What kind of new knowledge or new ways that we're looking at? Because we can't afford to lose more people to this when there are ways to fight it, actually. Maybe not to eradicate the virus, maybe not to kill off all the mosquitoes, but in order to treat it, there might be things that we can do better in terms of awareness. Prof, we go to that after this short break. Terima kasih kerana masih menonton Agenda Awani. Pengarah saya malam ini berkeras untuk saya terus pergi kepada rakan saya yang begitu bersedia di set Kini Trending. Jadi saya pergi bersama dengan Umaira dulu untuk mengetahui apa yang diperkatakan di media sosial tentang denggi. Umaira, silakan.
Terima kasih, Kamarul. Resepi atau cara-cara menyediakan penawar denggi dari daun ataupun pucuk daun betik mencuri perhatian ramai di media sosial. Mungkin kerana jumlah kes denggi yang semakin meningkat, orang ramai kagum penawar dan dikatakan ubat denggi ini sebenarnya sudah pun wujud di laman luar rumah kita sejak lama lagi.
Jus daun betik ini merupakan rawatan alternatif membantu meningkatkan platelet darah. Resepi bonda antara yang berkongsi cara menyediakan jus daun betik di Facebook. Selain itu, Yusaini turut berkongsi cara-cara menyediakan jus daun betik. Gambar ini mengingatkan bahawa jus daun betik hanya sebagai rawatan sampingan dan bukan rawatan khas untuk denggi. Namun kesemua rawatan ini perlu mendapat nasihat doktor, terutama sekali bagi pesakit berusia bawah 13 tahun. Hanya satu harapan orang ramai di media sosial, iaitu tidak ada orang mengambil kesempatan menjual harga daun betik ini dengan mahal. Pohon betik boleh ditanam di mana-mana sahaja di Malaysia, termasuk laman luar rumah kita.
Apa salahnya kita cuba ikhtiar lainkan selain pada ubat preskripsi doktor? Kamarul.
Umaira pernah kena denggi, Umaira?
Oh, tak pernah lagi. Harap-harap tidak.
Tak apa. Kalau kena, dengar ya diskusi ini supaya kita boleh tahu lebih lanjut.
Pasti.
Kerana bagi kami di Awani, cukuplah setakat Samson. Itu anggota warga kerja Awani yang kami kehilangan beliau pada usia yang begitu muda. Tetapi mungkin dengan kesedaran yang lebih tinggi. Dan malam ini, kesedaran itu adalah tentang pendekatan klinikal. Ada pakarnya sini. Prof, I would like to continue to talk about this, especially in with my friend Umaira right there, klik, just said, you know, on social media you put out crab soup, papaya juice or whatever it is, and desperate people will cling on to it and they will have to try because being a patient of dengue while I was stricken, you know, sometimes you feel so helpless and people close to you will feel like they want to help. So when they hear this and they know there's no cure for dengue, so they will try to use. But I think in the first segment just now, we've made a clear line of demarcation between the fact that platelet count alone is not the only thing to watch out for in a dengue patient case. So you were telling me during the break that, you know, hospitals or institutions that looks at dengue patients or even health practitioners, doctors at the front line, nurses, they should also relook at how they approach dealing with dengue patients.
Yeah, you're right. We have tried for many years, but you know it is very hard to teach people who think they already know the illness. They say, well, I already know. I know it's all about platelets.
Okay.
When that was how, you know, and then I said that no, it's more than platelets. And in fact, when we teach, our first slide is that dengue is not a platelet count disease. It
Let's
is
put
much
that
more.
up front.
Yes, up front. Just, you know, you've got to smash that illusion straight away.
Because you can lose patients that way.
Yes,
by just looking at it.
Yes, precisely, because once you focus on this enemy, you don't focus. You don't realize that this is a problem. When you're focusing on this is not the problem. This is just telling you that they are still in the critical phase, that you better do something else. So It is very difficult to re-educate doctors and even the public. And I think that part of the problem starts with the name denggi berdarah.
Okay.
Yeah, long time. In fact, we have decided and we have asked WHO, please drop this name. Because this denggi berdarah makes everybody focus on the berdarah and forget about the kebocoran plasma. So that kebocoran plasma, you put a denggi berdarah, dengue hemorrhagic fever. The doctor saying, oh, I already know it's about the hemorrhage. But in actual fact, we see a lot of patients with platelet count 0 with no bleeding. They don't bleed if you take care of the shock. So our focus is, we teach the doctors that you have to relearn and then look for the shock and manage the shock.
Can you explain that part? When I was reading the materials online about that dengue shock that you can go into, if you can please explain that a bit more.
Yeah. So what happens is that shock means that our blood pressure goes down. Okay, because why? Because all the fluid has come out. Okay, the kebocoran, you imagine a bag filled with fluid, and then you puncture all the holes, and then the fluid slowly leaks out somewhere in the bag. So our circulation has got that kind of lining, and usually there's a little bit of leakage, but it's a small amount. But in dengue, once our antibodies start come up and interact with the virus, now that lining in our blood vessels, it's not the big blood vessels, it's the tiny blood vessels, kita panggil the capillary. They have only one cell thick. Okay, so those become leaky. Okay, that the cells in that becomes a little bit leaky, and then fluid can go out. Now it depends on how much volume that goes out. Kalau the volume is very little, and most of the time there's a little bit, patient can drink a bit more water. They'll feel a bit thirsty. I want to drink, and they drink. And they don't pass urine, then where did the water go? The fluid must go somewhere. It's still inside the body. So we always say that if you drink a lot of water and you're not passing out the water, then the fluid has gone somewhere. So we say that most likely there is some degree of capillary leakage. Now in some patients, particularly the younger children, the leakage can be very fast and massive. Now when it is very fast, very massive, then the volume suddenly goes down, right? So that's when the blood pressure will drop. So usually it doesn't drop like this. Okay, in life, God is very fair to us. The body will compensate. So we train our doctors to look for these compensation signs. So we call them the early shock signs. And even before the patient goes into shock, there's another period of a few hours, depending on the age of the patient, where there is what we call the warning signs. So if you read about it, we talk about warning signs. Now the warning signs just tells us that these group of people with the warning signs, they are at risk of going into shock. Right, so we use the warning signs to train our doctors to recognize these patients. So what are the warning signs? Severe abdominal pain. So very sakit. They forget that they had fever. The patient forgot that he had headache yesterday. Today, this morning, fever no more, pain. Then they don't think that it's related the two because fever no more.
That's a very important part. My director is screaming at me to go to break, but I wanted to make that point because this is about human life. We don't want to lose anyone to dengue. So you must listen to that. I'll come back after this break, and I promise you we will get to this fact that there are things that if we know, we could help save people that matters to us from the death of dengue after this. Setiap kali saya membincangkan tentang isu berkaitan dengan cukup setakat Samson, ia begitu meninggalkan kesan bagi saya kerana kalaulah saya berbincang dengan Prof. Lucy mungkin ketika Samson masih ada, maka apabila dia kembali bekerja selepas demam begitu tinggi, mungkin saya boleh menasihatkan kerana tak semestinya masa demam tu masa yang tidak ada demam tu sebenarnya masa yang paling genting sekali secara klinikalnya. Jadi mungkin Prof, if you can go, we have only about 3 or 4 minutes left. So the other part about
the warning signs.
Yes, the warning signs.
Yeah, I think that when the fever comes down after the 3rd day, then it will because our antibodies are already up, that is when things are going to happen. If they are going to happen, it's not going to happen suddenly. All right, God is very kind. They will start with the warning signs. The patient will feel, first thing is the pain in the abdomen, and then if you ask them to drink, they vomit. Sometimes they won't vomit. They say that if I drink, I vomit. So if I don't drink, I don't vomit. So they don't vomit. If the doctors ask, got vomiting or not? No vomiting. So they miss the warning sign. But if you ask, did you drink? Oh no. Why? Because if I drink, I vomit. So obviously the patient has got very severe vomiting. So these two are very, very important. And then sometimes they feel very tired. So sometimes we say that, well, what do you do when you feel tired? Go and sleep. Sometimes they never wake up after that. They just die there. So we have had these situations like this. So these are the three very important warning signs. And then of course, if you are bleeding, then you feel, like your hands are very cold. And then by the time you feel difficulty in breathing, it's very late shock. So the three important ones are the vomiting, abdominal pain, and the feeling very tired. So the tiredness, people don't put very much attention. I'll just go and sleep. They think that it's okay.
Because you have fever, then of course you'll be tired.
No, but that time no fever already. They say, oh, no fever already. I should be getting better. Even doctors themselves, think like that. Oh, my fever is over, but I'm still tired. I just go and sleep. I say, hey, you better go and check your blood. Your fever is down. You should become stronger. You should be eating, drinking. If your fever is down and you're not drinking, you better go and check your blood. You probably have plasma leakage. Right?
And to empower layman, if you know your area has got dengue and it's around, so the moment you've got some semblance of fever, better go and check it out as soon as possible.
Yeah, I think it is important to check, but also I think there's a lot we can do on our own. Like drinking, we make sure that we drink enough fluid. I think people, sometimes I see patients, they are all dried up, and I ask them, have you drunk? And it's 12 o'clock. 12 noon, have you drunk any water? Oh, belum. I said that you are having high fever and it's such a hot day and you haven't drunk. When was the last time you passed urine? Oh, pagi hari ini belum kencing. I said that, wow, you're very dry, you better drink. So make them drink the water in front of me. And you must drink slowly. You cannot plop, because you drink plop like that, you will out like that.
I can identify with that. I've suffered that. Prof, terima kasih banyak. You have to come back. I hope Prof Adiba will have time to come back to this show also, because I want to tackle more strategically on the clinical aspect of facing dengue. Terima kasih banyak kepada anda. Hantarkan pandangan anda sendiri kepada pelbagai platform yang Astro Awani ada. Dengue ini perkara serius di negara kita dan banyak juga negara lain di dunia. Dan dalam konteks itu, kita tidak mahu sesiapa pun menderita apatah lagi terkorban akibat serangan virus dengue. Cukuplah setakat Samson. InsyaAllah dengan pengetahuan dan ilmu kita boleh pastikan perkara ini kita jayakan supaya tidak ada lagi korban dengue. Sekian, selamat malam. Terima kasih. Jumpa lagi.